Hi guys, Mark from Fit Plus Well here.
And G from Altitude Fitness and Health.
We're both keen runners, and as exercise professionals we see a lot of running type injuries. So we've decided to do a set of videos to help you prevent and overcome these injuries.
We've divided these videos into the hip region and the knees, the ankle and the core. So let's get started.
Exercise 1, the 7-second plank. This exercise is important because the deep core muscles increase stability around the lower spine and hip region. These muscles help maintain a neutral spine and pelvis when performing functional movements such as activities of daily living to exercise. Lay on a mat facing down with your elbows bent by your rib cage. Drive your belly button towards your spine, contracting your pelvic floor muscles as if you're holding a Wii. Push off from your elbows so your body is in a totally straight line from your shoulders to your toes. Breathe in and out for 7 seconds, then lower yourself. Relax your abdominal or stomach region, then perform the plank for another 7 seconds. Repeat 10 times. Exercise 2, bird dog. Begin on all fours with your hands directly under your shoulders and your knees directly under your hips. Pull your belly button towards your spine, keeping a nice straight line from the back of your head to your buttocks. Bring your left knee and right elbow together under your torso without rounding your back as you exhale. Keeping your torso stable, slowly straighten your right arm and left leg. Reach through your left heel to engage the muscles on the back of your leg and your buttocks. Repeat with the other side. Exercise 3, side plank with knee drive. Lie on your left side and position your body in a side plank, with your legs straight and your weight resting on your left elbow. Your body should form a straight line from your head to your ankles. Place your right hand on your hip, lift your bottom leg and drive your knee towards your chest. Repeat on the opposite side. Exercise 4, cable core press. With the hand overhand grip, grab a handle attached to the mid pulley of a cable station. Stand with your right side facing the anchor. Spread your feet about shoulder width apart with your knees slightly bent. Step away from the anchor so the cable is taut. Hold the handle against your chest and pull your belly button inwards to fight the rotation force. As you exhale, slowly press your arms in front of you until they're completely straight. Pause for a second and bring them back while you inhale. Perform 10 repetitions and then change and work on your opposite side. Exercise 5, reverse lunge cable core press. With the hand overhand grip, grab a handle attached to the mid pulley of a cable station. Stand with your right side facing the anchor. Spread your feet about shoulder width apart with your knees slightly bent. Step away from the anchor so the cable is taut. Hold the handle against your chest and pull your belly button inwards to fight the rotation force. Move your right leg back and drop into a reverse lunge position while you straighten your arms. Drive your left heel into the ground and bring your right knee up as you pull your arms in. Perform 10 repetitions and then work on the opposite side. The following exercise will demonstrate how to find neutral spine and neutral pelvis. This exercise is important because with all the movements we perform on a daily basis, our bodies are constantly performing muscle contractions to maintain balance. Keeping a neutral spine and good posture helps prevent injury and dysfunction. Stand up with your feet together, head up, proud chest in front of a mirror. Place both index fingers in front of your hips on your hip bone and your thumbs on top of your buttocks. Imagine your pelvis as a bucket full of water. To make the water flow in front of you, rock your hips forward, creating an exaggerated curve in your lower back while maintaining an upright posture in your upper back. Your index fingers should be lower than your thumbs. Rock your hips backwards by squeezing your buttocks together, flattening your lower back, but still maintaining an upright posture in your upper body and keeping your knees straight. Your thumbs should be lower than your index fingers. Repeat the rocking movements 4 to 5 times before settling right between these two extremes. This is your neutral pelvis position. Exercise 1. VMO 30 degrees extension. This exercise is important because the VMO is one of the 4 quadriceps muscles. It is located in the inner front part of the thigh and is very important with knee stabilization as it keeps the kneecap in proper alignment. The VMO activates in the first 15 to 30 degrees of knee extension, and misfiring of this muscle can cause damage to the knee structure, resulting in pain. Standing in a split stance with the injured knee forward. Wrap the resistance band behind the weak knee and attach it to a secure object in front. With your foot flat on the ground, keep your back straight, then bend your knee forward. Lock out your knee against the resistance of the band while squeezing your glutes and hold this position for 5 to 7 seconds. Perform 3 sets of 10 to 15 repetitions, providing the exercise is pain-free. Exercise 2. The Clam, glute activation. This exercise is important because the gluteus medius is one of the 3 glutes muscles and sits at the superior part of the buttocks. It is responsible for hip abduction and external rotation of the leg. When running, the glutes medius works closely with the vastus medialis to keep the knee tracking properly over the foot. Misfiring of the glutes medius can lead to too much internal rotation of the leg, resulting in knee pain and damage. Lying on your side, keep both knees bent with your hips flexed at about 45 degrees. While keeping your heels touching and pelvis still, open your knees by contracting your glutes. Perform 3 sets of 10 to 15 repetitions and switch sides, providing the exercise is pain-free. You can progress this exercise by wrapping a resistance band around the knees for added resistance. Exercise 3. Side leg extension, hip abduction. This exercise is important because the adductors and abductors are both important in a runner's stride as they help stabilize the pelvis and ultimately the knee and ankle. The hip abductors, comprised of the glutes minimus and glutes medius and the tensor fasciae latae, help maximize the running gait cycle by controlling the sideways tilt of the pelvis. Lie down in a sideline position. Make sure your hips are directly over each other and that your body is in a straight line. Place your top hand on the floor in front of you to help ensure that you are not leaning forward, and rest your head on your other arm. Lift the top leg up while breathing out, holding for 2 seconds in the top position, slowly returning to the starting position, breathing in. Perform 10 to 15 repetitions, then switch sides, providing the exercise is pain-free. You can progress this exercise by wrapping a band around your ankles for extra resistance. Exercise 1. TALIS mobility with exercise band. This exercise is important because the talus is a free-floating bone in the ankle joint. Because of its lack of muscular attachments, it can easily become misaligned, leading to movement impairment. If you lose mobility in the ankle, your knee can become unstable, setting it up for possible injury. The ankle acts as a shock absorber and energy distributor, and if the range of motion is limited, this can lead to pain and damage in your knee. Secure the band behind you and wrap it around the front of your ankle. Keep your heel on the ground and your knee outside of the second toe. You can use your other hand to stabilize the heel. Slowly flex at the ankle, starting with your knee positioned over your ankle, flexing as forward as you can. Repeat 15 times on each foot. Exercise 2. Plantar myofascial release. This exercise is important because the soft tissue structure in the sole of the foot is directly connected to the muscles of the lower leg. In a seated or standing position, and with the ball under your foot, slowly massage from the front of the heel in circular movements for approximately 10 seconds. Progress by moving to the midfoot and onwards to behind the toes. Ankle eversion, inversion. Sit with your legs extended in front of you. Wrap a band around the right foot and hold with both hands, creating tension. Rotate your foot inward, then outward in a slow movement. Repeat with the opposite foot. Ankle flexion extension. Wrap a band around the right foot and hold with both hands, creating tension. Slowly bring your foot towards you, resisting the pull from the band, then extend it all the way back, pulling against the band. Small foot. In a seated, non-weight bearing position, push through the big toe joint while raising your mid-foot arch. Holding for a few seconds, then relax your whole foot before repeating the movement. Make sure you relax the other toes as they will try to grab onto the floor to help the arch raising. Thanks for watching, guys. Remember, these videos are intended as a guide only, and you should seek professional advice for any injuries of concern.
But for more information and more tutoring videos, please check the links below.